A bit of health now. A non-profit organization has identified the need to intensify efforts in raising awareness on sickle cell anemia, considering the high rate of the disease in Nigeria. They say sickle cell is not a death sentence. Zainab Akonde has more in this report.
A report by World Health Organization reveals that over 300,000 babies with sickle cell disease are born yearly. With Nigeria at the epicenter in Africa, the disease is caused by genetic mutation, which results in the red blood cells forming a crescent-shaped cell in the body, restricting easy blood flow. Although there have been various advocacies on sickle cell, a non-governmental organization in Lagos is committed to providing support and resources to sickle cell patients, especially children.
Sickle cell is not a death sentence.
We want to change the mentality of the people that if a parent have a sickle cell child, just write it off. Many, even their parents themselves, they even use their mouth to make those child, not to grow, not to believe in themselves. But once they are encouraged, the sky is the beginning, not the limit. So anybody living with sickle cell.
The only preventive measure is that if you are AS, don't marry AS. If you are AS, you know that you cannot marry AS, you cannot marry SS. You have to marry AA. There is no sickle cell disease in my family. My mother family did not have sickle cell. My father family did not have sickle cell. How will I now have, sickle cell children? So, religion is a major problem for us in this country.
Amira Yunus is a 9-year-old female who has just undergone a successful bone marrow transplant with the help of the organization. Although she could not speak to us, her mother says the operation helped replace the bone marrow that was not producing enough healthy blood cells.
So far, so good. No complications, no stress, everything. She's eating well now.
Vera Arua, a sickle cell warrior, explains how the disease affects her financially, mentally, and emotionally.
It's been from one hospital to the other, one crisis to another, blood transfusions, treatments, and I tend to have what they call varicose veins, invisible veins. So it's always very difficult to get a vein, so they're poking me here and there all the time. It's an experience of constant pain. You have the trauma, you have depression, sometimes you're just exhausted. Caring for someone living with sickle cell is expensive. You have your routine meds on a daily. In fact, I don't like to keep budgets. I don't like to keep costs. I don't want to think about it. And a constant vocabulary with me is that I'm tired. And people will be like, what did you do? And I'm like, okay, obviously this one doesn't understand.
I also met Ayola Olajide, who will turn 60 in 3 months. Says he has learned to live with the disease and is now an advocate.
October 19, 2006 is a day I will never, never, ever forget. I could not walk, I could not sit, I could not stand, I could not lie down. I was just rolling around and screaming and yelling in pain. The nurse came and embarrassed me. She said, keep quiet, you are disturbing the whole ward, the emergency ward. I looked at her and I wanted to curse that this woman doesn't know what I was going through. How can she speak like that to me? Acceptance comes along the way, you are diagnosed as a child. And as a child, you know nothing about it, only that you are different from others.
With Nigeria being the most populous country in Africa, it is hoped that the government will channel more energy in creating healthcare centers that will cater for sickle cell treatments. Zainab Akonde, TVC News, Lagos.